Welcome to another episode of Hala City Podcast. I've got my good friend today, Dr. Naser, here to explain some things about childhood cancer and hematology disorders. So, Doctor, can you tell us a bit about you and how you ended up here in the UAE, in Dubai?
Thanks, Aaron, for having me here today. My name is Naser Zein. I'm the pediatric hematology oncology consultant who's currently practicing at City Hospital in Dubai Healthcare City. Before that, I did my medical school back home in Jordan. Then I went to the United States of America, where I did my pediatric residency and followed by fellowship at the Mayo Clinic in the USA. After that, I did my own practice in the USA for a few years, where I became the medical director, where I practiced in the University of Iowa. In 2009, I came to the UAE in hope to help the kids in this region. And I was stationed in Abu Dhabi in one of the largest tertiary centers in UAE. I served there for more than 14 years and I became the chief of the service there. And since I kind of felt my mission has completed there, I looked for another opportunity where I can help kids in some other parts of this country. So I decided to move to Dubai, and I've been in Dubai for the last 2 months.
Well, we're lucky to have you in Dubai, definitely. What is the sort of main sort of hematology and sort of cancer you're dealing with children here at City Hospital?
That's another great question. So what we're kind of really, pediatric hematology oncology is a really wide spectrum of disorders, and you kind of really need to divide them into two major categories. First category, which is the bulky usually, is the benign types of disorders. And those are what we call the non-life-threatening disorders that most of them could be hereditary, like you are born with, or you got those from your parents. And on top of those kind of disorders are the thalassemia syndromes, as well as sickle cell syndrome, or what we call hemoglobinopathies. The other one that's kind of really some people get scared to when they meet us is the oncology part, which is the cancer. And this is not uncommon, actually, as well as in adults, the same. And we have really good numbers of kids who are diagnosed with cancer all over the world, and the UAE is not an exception. We get really maybe around 200 plus kids in the whole country being diagnosed with different types of cancer. We also, from our statistics and kind of really observation, we noticed that in UAE we follow the same kind of prevalence and incidence of those kind of disorders, with acute leukemias being on the top of the list of those types of oncology disorders. So in City, we kind of carry most of those disorders, including leukemia, as well as the most kind of common cancer we treat.
So here at City Hospital, what advancements have we got with diagnostic testing and trying to identify what the child is dealing, what sort of cancer the child has, and what sort of diagnostic sort of support would we have here to look after that child here?
That's another good question. So in City Hospital and in the whole chain of the hospitals, really, we have all the resources needed. And the good news about working in this place, as well as in Dubai in general, that we really have what we need. And that would include the proper initial diagnostic kind of tools, for those kids. Remember, most of those kids, we are not the first encounter for them. They come to their primary care provider, to the family medicine, to the pediatrician. They're complaining of something like being sick, having fever, not feeling well, like low energy kind of thing. And then they run the batteries of testing and they discover that they have something kind of worrisome. So they refer them to us for more confirmation. And this is where we encounter them as a second line. But once we get those kids with the suspicion that this could be something like leukemia or some sort of an oncology disorder, we run more kind of advanced type of testing that we luckily have it here within the institution, as well as within our sister hospitals. So we have, we can do all the bone marrow studies, for example, for leukemia. If we talk about leukemia, we can do all the bone marrow studies and testing that we need, from morphology, the way those cells look like, to something called flow cytometry, to the genetic testing, as well as to the more advanced kind of studies that will detect even the least amount of those kind of types of leukemias or cancerous cells in the child's body, to be able to tailor our treatment accordingly. Believe it or not, this happens in no time, which means we don't waste much time to be able to nail down the diagnosis, and to initiate treatment with no delay. To mention also, I mean, we get supportive services that includes like our pediatric surgery, neurosurgery for kids with brain tumors, for example, orthopedic, like the bone doctors for kind of kids who get like bone tumors, all kind of things, as well as we have all the multi-specialties that we need for consultation. Like if I need a cardiologist, they are aboard with us on immediately. Kidney doctors, nephrologists, whatsoever, they are always available for us for consultation and help. One of also kind of the secrets of success is that in oncology world, you always do what we call multidisciplinary team approach and meetings, or MDT. And this is very important. And here it has been the rationale to do kind of this type of care. And that helps to kind of really delineate the treatment for those patients and to make sure that you are doing what's right for them and what's more appropriate.
So, Doctor, it sounds you're very passionate about everything that you're doing. You have an army of people at your disposal to help you diagnose, treat, and even make a management plan for the children, which is fantastic. But I want to know, as a clinician, what are the challenges you face with childhood leukemia? What is the barriers, and how do you get around all those things?
The most important thing is kind of the awareness of cancer, the awareness for cancer. What is like makes sometimes our job difficult is that people are scared from the word cancer. When they come to you, they think that their child is dying. And even, I'm not saying this about even kids, even adults who come with cancer. People have this concept that if I have cancer, then I'm close to death, which is not true anymore. If we look at our kind of data, we see that in pediatrics, like, cancer cases, we have more than 85% kind of survival rate now worldwide. And we're not an exception here. We're really also, I think we achieve the same, not even maybe better than this kind of rate. So the first thing we get a challenge is to be able to absorb the families and kind of those patients, to be able to deliver for them the news and kind of really to make them cope with the whole process and kind of take them to the next step, which, as I told you, which is treatment, and to be able to achieve the goal and the target. So sometimes the problem is that you may face sometimes the support of the social services. So kind of really the presence of a social worker, the presence of the psychologist with you, or even sometimes if it gets really more complicated, the psychiatrist, sometimes you may need to be part of this thing. But without even those kind of resources being handy, we also try ourselves. With time, you get the skills, like, you kind of how to communicate and navigate and how to break the news. The most important is how you break the news to this family. And this is something you get with time to know how to do it. We try to avoid like big kind of words like for them so they don't get scared, and we try to make it easy on them. The most important is to give them time. Give them time to absorb, because they will be in denial, then anger, and they may project that on you. So you need to be ready for it. So the most important really is the psychosocial. From medical point of view, I believe that in City Hospital, we've been kind of really having, as I told you before, a lot of advanced kind of really tools that I feel very happy and I feel really secure to take care of those kids in general, but mainly I'm talking about kids with malignancies.
I think one thing I know, Doctor, dealing with sort of parents for many years, is parents worry once the diagnosis is done. You just sort of touched on it a little bit, that parents get, and the child, there's a lot of support at City Hospital for that child. Yeah. So obviously the impact in the diagnosis, you've touched on some of the services, but how do you've initiated told a diagnosis to a family. So what mechanisms immediately kick in for that child once they're diagnosed? What is it, over a short space of time or a longer period of time?
So once we know the diagnosis of the child, or we're kind of sure about it, we confirm it, First of all, we don't deliver the news we're only suspicious. You have to confirm, because you want to make sure that the family will trust you. They trust you, Losing confidence and trust in you is the worst thing you can have as a practitioner, especially in my specialty. So what we need to make sure, once we make sure that the diagnosis is confirmed, and it's solid, we try to kind of meet with the family. And what I usually do, I meet with them on phases, So I try to see who's kind of the most reasonable kind of person in the family as a member. Could be the mother, could be the father, could be the older brother, or could be like one of those cousins. And we try kind of to navigate with him or with her what's going on, and to prepare for breaking the news. This may be kind of done on the same day, not necessarily like I do this today and tomorrow I gather the family to talk to about the diagnosis. So if I find that the family is ready, then I will I would like to bring them in. And what we've been also great in doing that, we created what we call a family lounge, because at City Hospital, we have our own dedicated pediatric oncology ward. And with the help of everybody, including the senior management, we were able to create a family lounge, which is a very comfortable kind of room. You have everything in it. You have a TV, you have books, you have really, really kind of couches. You feel like it's homey for you. So you sit with them, and you kind of really, the most important, when you talk to them, talk with a smile. Don't look serious. Don't look like as if you are kind of gonna tell them this is the end of the world, judgment day is coming. No, you have just to sit with them with a smile, but at the same time, you have to show confidence, and you have to have a plan in your head, in addition to be prepared for the questions that they may ask you about. And we kind of know most of what the parents and family members would ask us when we have a child with cancer. We know that. With time, you get this kind of experience. So that's how we do it. But in addition, I will call some of my team members. And it's always good to have a female kind of figure with you, not because you don't trust or something, but because sometimes they kind of give the sympathy and empathy, that you may need more than I can deliver, despite we do have this sympathy and empathy. But those kind of ladies kind of have maybe better kind of approach, especially to the mothers, remember, we are kind of also sort of pay attention to the culture. So she can bat on the shoulder of the mother, she can give her a hug or something like that. So I utilize everybody whom I think is kind of really fit and qualified to help me in breaking the news. And if we feel that we need even somebody from outside the team, we do that. Let's say, for example, if the family comes from a surgeon who's kind of really was the first encounter for the diagnosis, and they got this trust and confidence in that surgeon, I will call him and say, please, could you please come with me, and I would like you to be with me in this meeting, because I want the family to feel like safe. They will feel secured. If they see this figure in that meeting, then they okay, things are okay. But if they only see me and they really don't know who I am, then that could create some kind of trust issues. The good news, alhamdulillah, we don't really encounter this quite often. Rarely I encounter this, but if needed, you have to have those strategies in your brain kind of, and to see. And the most important, Aaron, is that every case is unique by itself. You really need to plan and delineate everything for that case. Not acute leukemia is acute leukemia. No, it is acute leukemia as a pathology, as a disease, but it's not something I want to just apply it on David and on Smith and on Rashid. No. I need to make sure the way I deliver it to Rashid and his family is maybe a little bit different from David's family, And this is where your kind of, again, intelligence play a role as a physician, as a practitioner. And thank God, alhamdulillah, we are always kind of successful with that.
So, Doctor, obviously we have a multicultural society here in the UAE, which is fantastic. And you've been around the world, and your training is from all different places. Where do we rank, would you say, here in City Hospital and in Dubai in delivering those treatments, those world-class treatments? That why should we stay here? You think it's best to stay here or go to other countries? Why here?
You say it right. It's like world-style kind of care. And what's unique about the place here, as you said, it's the multi-ethnicity, the multicultural things. And being in Dubai, which is a very well-known now, or the most well-known city with the multicultural kind of diversity, forgiveness, tolerance, all kind of those things. This is the concept and being the principles in the country in general and mainly in Dubai. You will never feel stranger here. You'll never feel like, oh, I'm a foreigner here. But the most important, again, with all this kind of cultural diversity, all the ability to absorb the people beliefs, the kind of the way they think and those things. We have also the medical resources. This is very important. We have all the medical resources. If you look at us in City Hospital, and I'm telling you as a physician now, we're going to talk about the medical part. We have all needed specialties. I have the orthopedic oncology surgeon. I have the pediatric surgeon. I have the neurosurgeon. I have the lab facility. I have the specialties that I need in pediatrics for me to support me. I have my dedicated pediatric oncology ward with the state-of-the-art kind of rooms, the facility in general. In addition, it's a very friendly facility, it's a patient-friendly facility. So people feel not as strangers. They can walk in to see us, in no time, no appointment, and we will be welcoming them and see them and really answer all their questions. If they need any kind of help, we do that help. We give them that help. We don't question why you're here. No, absolutely not. We take them, because the most important, I will tell you, this is my message. When your child have a hematological disorder, disease, and I'm talking mainly about cancer, you become a member of the city family. You are not a stranger. You are part of us, and we are part of you. So we really care about you and your child, as well as anybody you think is important for you. This is how we practice. And this is where the success in pediatric oncology, because we look at the holistic approach more than kind of the individual approach. I treat them as entity. I treat them as one unit. I don't treat them as individuals. And this is very important for us.
That's good, Doctor. I think that's really interesting to know. There obviously now social media and the ability to find things on Google and things like that for parents. They're looking at different research all the time. They're looking at different advancements in cancer treatment. How is it here at City you're looking at research and keeping yourselves abreast of the changes in treatments across the globe?
Mm-hmm. So we try to keep up with the research and the most up-to-date. I can tell you something. I am what we call a children oncology group member. I'm one of the very few proper children oncology group members in the region. So that gives us a full legitimate access to all the most up-to-date in treatment and research based for kids' cancer. And we are utilizing this really well. In addition, because of that, we were able to implement the kind of utilizing the most up-to-date, what we call targeted therapies, immune therapies, that kind of really has been changing the paradigm of childhood cancer outcome and cure rates. And we do have all those kind of resources, and we've used some of them in the past, and we will use some in the future. And it's based on case per case, So that's why we improved in our cure rate for those patients. If you have a child with leukemia, he needs an immune therapy. We will give the monoclonal antitherapy like treatment for him. If he needs kind of really further kind of more targeted therapies and he's eligible for that because of his disease, we'll do it. We will get it. If it's needed, we will get it. And this is very important. Again, we don't compromise the care of those kids. In addition, if I need to, I will collaborate with other hospitals within the country, kind of to be able to deliver the best care for this child. If I don't have it here, which I don't think, I think we still have about maybe 95 maybe or more actually % of the needed care for kids with cancer within UAE. But if I'm missing those 5%, I will call somebody from my colleagues from other hospitals that I believe they may have this, and I will not hesitate to send this child to them to continue the care there.
Fantastic, Doctor. I think this leads on to my sort of next question from your answer. How do parents navigate and advocate for their child and get the best care in the healthcare system?
Once you break the news the right way, you kind of deliver what's happening to them. You need to make them your allies, you know? They need to be next to you, you know, shoulder to shoulder. And this is very important for us. And once you get them there, they will be the best support of the child, because no matter what I do, what my psychologist, my social worker, my nurses, how wonderful they are, the child will still look in the eyes of his parents and he will see he's trying to find the truth. And kids are smart. So if the parents are not into helping and support, we get into trouble. So we're very important for us when we get to this. I make sure those parents are very well prepared psychologically as well as physically, in addition to socially, to help me in this journey. And what I usually do, I keep counseling almost on daily basis. I have now a patient who is from Colombia. So every day, this patient's family, I talk to them, I counsel them, you know, because I know they're emotional. So I do that. I keep talking and talking and talking. And I was able, I think, from what I see, to get their support to help me with their child, because he's almost a teenager and he's very smart. So to be able to overcome any kind of feeling of depression or feeling down, you know, or kind of being distressed from the whole situation, being in the hospital, losing his hair, you know, and kind of those things. It's very important. So we continue to communicate with the parents continuously. And I'll tell you something, this does not end by the end of the day when we all go home to our houses. No. Actually, we have the tools to communicate with them even after hours. If they have a question to me or to any of my team members, they can reach us. And we will be happy to kind of talk to them and discuss things with them. Some people, I'll tell you something from my experience in the UAE. Some people, they may call me at 2 o'clock in the morning for no medical reason, just because some question popped up in their head, and I do answer it. I don't show them that I'm annoyed. Absolutely not. It's very important to keep the rapport with the family, because again, these are your allies in this journey. You want them all the time next to you, because for God forbidden, like something wrong happens with the treatment. Like I'm talking not a medical error, but I'm talking like sometimes the results are not as what you want, you know? You still want them to be next to you to support that child through the whole kind of path. And we try to make it, and we make it right.
Thank you so much, Doctor. I think the work you're doing here at City Hospital is amazing, and it's been a really interesting interview. Thank you so much.
Thank you, Aaron.
Thank you so much, Doctor, and I'll see you at the next episode.